Most people will have never heard of CIDP before, but they wind up going to their doctor after noticing neuropathy symptoms, balance and coordination issues, or weakness in their limbs, and they're told it's suspected. But what is it? CIDP, which stands for chronic demyelinating inflammatory polyneuropathy, is a painful and sometimes disabling condition that affects millions of people across the world. And if you're one of those people, then I promise you, you're going to want to watch this video until the very end because it's going to help you understand what causes it and how to slow or stop the progression of it. There is a lot of confusion around this, and there's a lot that people don't know about it. I'm Danielle Minetti, a registered nurse with 30 plus years of clinical experience in neurology and chronic pain. And this video is breaking down CIDP to help you navigate this condition and give yourself the best chance of controlling it. It is such a pervasive issue that I can almost guarantee that you know someone affected by it. So please share this video so we can make a dent in the information gap. Okay, so what's happening inside your body when you have this? CIDP is an autoimmune disorder, meaning the immune system, which normally protects the body, turns its attention toward its own tissues instead. In this case, the myelin sheath, which is the protective covering that surrounds the nerves in the peripheral nervous system, which are the nerves outside of the brain and the spinal cord. It's kind of like 2017 Justice League when Superman is resurrected, but he kind of comes back weird
He's
and
not
Pet
alive.
Cemetery-ish and attacks Wonder Woman, Batman, Aquaman, Cyborg, and the Flash. Same situation. The immune system is awesome when it's working for you, but devastating when working against you. And the myelin sheath is crucial for transmitting electrical signals quickly and efficiently along the nerves. Think of it as the plastic covering along an electrical wire. When the immune system damages this myelin, the nerve signals slow and get disrupted, and this leads to the weakness, numbness, and tingling you feel in your arms and legs. And this immune attack also causes inflammation around the nerves, leading to additional damage. And in severe cases, once the myelin is eaten through, the damage can continue down to the nerve axons themselves, which are these tail-like offshoots here. Now, you might be thinking, but isn't this what happens in multiple sclerosis? Is CIDP a form of MS? No, it's the same issue, but the difference is in MS, this myelin destruction is going on in the central nervous system. So the brain and the spinal cord, not the peripheral nerves. What are the causes of CIDP? As an autoimmune disease, we know that the immune system is triggered by something. But what causes a normally functioning immune system one day to do a complete 180 and attack what it was just previously protecting the next? There are several theories, so stay with me. Many cases are preceded by infections, with respiratory and gastrointestinal infections being the most common, but an actual causative organism hasn't been identified yet. CIDP is also associated with various illnesses such as lupus, HIV, hepatitis, and Guillain-Barré. In fact, Guillain-Barré is considered a cousin to CIDP because in both cases, the nerves are attacked and there's demyelination. However, the onset of GBS is quicker and reaches a more severe state in about 4 weeks, whereas CIDP presents with slower onset and it takes about 8 weeks to reach the same state. The thinking here is that infections by these viruses trigger T-cell mediated immune responses that target myelin in the peripheral nerves specifically. But there's also evidence of these activated T-cells crossing the blood-brain barrier. So it's just an army of immune cells that are told, attack myelin, myelin bad. And with enthusiasm, they do. The blood-brain barrier is normally very selective with what it allows to cross it. It's kind of like a bouncer at your favorite bar. If it slips up and lets the riffraff in, then things get squirrely. These cells just mentioned are only found in areas where the body is fighting infection. So think about that for a second. There are theories that point to pervasive but insidious invasion by viruses, bacteria, parasites, and fungus. And they camp out and hide undetected for long periods of time, which can continuously trigger low level, prolonged immune responses that maybe don't cause a fever or any escalation of symptoms that trigger medical attention, but eventually results in myelin destruction. Some of these organisms include Mycoplasma, which causes pneumonia, Lyme bacteria, dengue fever, which is transmitted by mosquito bites, C. difficile, which is a GI bacterium, and influenza, but there are many others, COVID being another possibility. So, in other words, most infections are diagnosed because someone feels sick, leading them to the doctor, presenting with obvious symptoms, but in this case, maybe someone was infected with, say, Lyme bacteria, but never exhibited symptoms that caused them to seek medical attention, so it was never treated. But there is research showing these organisms later being identified invading brain tissue, spinal fluid, and even certain cells like glial cells that produce myelin. Sometimes this is discovered through autopsy, or sometimes through targeted testing like spinal fluid analysis and MRI. And the interesting thing is when you mention these symptoms to your doctor, they're going to order a ton of blood tests to rule out or confirm whether there is an autoimmune process going on. But often these labs won't show any evidence of anything wrong, or maybe there's one or two values that might be off, but it's inconclusive. I have two patients right now that come to mind. Both have severe symptoms, but their lab work is virtually normal. And this is frustrating because unless you can meet criteria that demonstrates that you have a condition, insurance won't pay for the therapies that might possibly alleviate the pain or cure the root cause of it. And this is ironic because normally, if you have blood work done, most people are praying it comes back negative. But in this case, there's clearly something wrong. They're suffering with severe pain and are progressively losing sensation and the ability to walk. There is no question that there's some sort of like a process going on here, but time after time their testing is normal, and these people are actually praying that their blood work is abnormal or reveals something. It's it's something that's occurred to me so many times. Most of my career talking to people about their blood work, if I say it's negative, they go, "Oh, thank heavens, thank God." But in this case, with potential CIDP as a diagnosis, when that blood work comes back abnormal or normal, I should say, it's you can hear it. There's a huge breath of air expelled and they're frustrated and disappointed. It's this is what happens. So very frustrating condition. There's also research that's looking at mercury causing CIDP. Dental work is the biggest culprit with this. Many people have amalgam fillings, which is a mixture of metals, but mercury is one of them. And the FDA considers them safe, but they can release mercury vapor when they're first placed, removed, or during chewing, which can be absorbed into the body, particularly the brain, kidney, liver, lungs, and GI tract. Of other concern are medications that we're told the liver filters and then our kidneys excrete, ridding them completely from the body, but this might not be entirely true. Some medications, like local anesthetics used in dental work, C-sections, and any other number of procedures, as well as other anesthetic agents like propofol, have been found to remain in the tissues long after they were supposed to have been metabolized and gone. There's a lot of research that still needs to be done, but it is a deep rabbit hole that at least provides food for thought and an alternative to we just don't know what's triggering the immune system to attack nerves. I've always felt that there's got to be a better explanation than this. And then to round out potential causes of CIDP, you have toxins, vaccines, and diet can also play a role. I mean, diet goes without saying. We are what we eat, but nowadays food is different than it used to be even when I was younger. More additives, processing, and all kinds of franken ingredients. So unless you have the ability to grow your own produce and hunt for your own meat, I can't even say that eating organically truly helps because the soil's affected. Some will say the answer is keto, some vegetarianism, veganism, cutting out sugar, carnivore diet. I have heard it all. And cutting out sugar is never a bad thing. It's the only one here that I'm going to say absolutely I can 110% get behind. However, each strict diet type brings with it its own problems. So it's definitely not a one size fits all situation. Many of you will comment that you've cured your neuropathy by following a strict fill in the blank diet. Great. But you have a specific health history and body composition that differs from someone else who maybe keto is dangerous for due to chronic kidney disease. You see the point I'm trying to make. So beware of claims that you see in comments or other videos saying, I cured my neuropathy with this one thing. It is never quite that simple. So this is a question that's best looked at with the help of a dietitian if you want to investigate this as an additional method of supporting nerve health. I happen to be very distrustful of our food industry and the guidelines in general. So there are certain things that I recommend you supplement with as well, and that I take to manage my own peripheral neuropathy. What are the symptoms you'll notice with CIDP? Well, symptoms can vary based on the type of CIDP that you have, of which there are 4. Basically, they're broken down into either motor or sensory variations, but the most common symptom is muscle weakness that gets worse over at least 8 weeks and typically affects the muscles equally on both sides of the body in the hips and thighs, shoulders and upper arms, and hands and feet. Clumsiness, tripping, frequent falls, difficulty with fine motor skills like buttoning or brushing, numbness, burning in extremities are all possibilities. And symptoms will gradually progress over weeks or months, but 15% of people will have a steady progression rather than a relapsing, remitting type course. Tremor, foot drop, and muscle twitching can also develop, and if left untreated, it can progress into absent reflexes, the inability to walk, and severe pain and burning. So what testing will be done to confirm diagnosis? Again, CIDP can be challenging because its presentations can vary wildly, but remaining persistent is imperative. Early diagnosis and treatment can arrest progression and prevent permanent damage. However, it's also important to know that about 50% of cases can just be flat out incorrectly diagnosed as well. So, as I said earlier, no laboratory testing exists to definitively confirm CIDP. Instead, these tests help to rule out alternate diagnoses that can mimic or be associated with this condition. If it's suspected, expect to have an absolute boatload of blood drawn, fasting serum glucose, glucose tolerance test, calcium levels, BUN and creatinine, which checks kidney health, complete blood count, better known as a CBC, thyroid function studies, vitamin and mineral levels, Lyme antibody testing, C-reactive protein, which shows the level of inflammation going on, anti-nuclear antibodies, or ANA, which is indicative of autoimmune activity, and a bunch of others. Aside from this, you'll have an EMG or an electromyography and nerve conduction tests, and these will both evaluate the health and function of your skeletal muscles and the nerves that control them. They specifically look for demyelination changes, so like slowing of impulses and conduction blocks, to distinguish CIDP from the more common types of neuropathies, diabetic neuropathy, small fiber, even idiopathic, which just means we don't know what's causing it. Shocker. Spinal tap or lumbar puncture may also be done, but not as a rule. This is where your health provider inserts a rather large needle into your lower back to get a sample of the fluid that bathes your brain and spinal cord. In about 85 to 90% of CIDP cases, there's a normal amount of white blood cells and an elevated amount of protein that's seen on analysis. Other abnormalities in the CSF may point to other conditions. An example of this is in MS. We'll see oligoclonal bands, and if there's even just one of these cells, it's a strong indication that they have MS, because normally there are none present. Zero. So yeah, this is one of the instances that will test that. MRI or magnetic resonance imaging of your spine may be done to look at whether the nerve roots are picking up contrast dye, which can also support the diagnosis of CIDP as well. And then finally, in rare cases, an actual nerve biopsy may be recommended to look for pathological evidence of demyelination. And this is a surgical procedure where a small piece of the sural nerve, which is here on the outside of the ankle, is taken for direct evaluation. But this can obviously lead to more risk than I think the diagnostic value of the test is worth, with permanent sensory loss, chronic pain and scarring, and wound healing issues occurring. After this type of nerve biopsy, the sensation is permanently lost in the outer part of the foot, which is an expected side effect. So this will typically only be done if all other means of diagnosis have been exhausted. And even then, I have never had a patient that's had one. Anybody that has, or their doctors told them that they want to do one, drop it in the comments. I'd be very curious. I mean, I think in 20 years of working in neurology, I have never had a neuropathy patient or a CIDP patient tell me that they've had an actual nerve biopsy, a surgical nerve biopsy. Can CIDP go into remission, or will you always have symptoms? About 90% of the people with CIDP improve with treatment, but about 50% of those people will relapse. Long-term prognosis is generally good for people who are diagnosed at a younger age and depending on their general health, though significant improvement can be achieved really at any age if the treatment is initiated as soon as it's been diagnosed. Where you run into issues is when the condition is allowed to progress unchecked and then treatment is delayed or never rendered at all. The longer this takes, the greater the likelihood of developing permanent nerve damage that results in permanent disability. So what are the treatments for CIDP? And there are 3 go-to first-line medications that your doctor or NP will reach for, and these include corticosteroids like prednisone, which helps improve inflammation by suppressing the immune system, and many find relief with them alone. However, they can cause serious side effects, which will limit how long you can take them. And because of this, you may also be prescribed other immunosuppressants alongside steroids, drugs like azathioprine, tacrolimus, Cellcept, and Xeljanz. The second go-to treatment might be plasma exchange, and here a machine separates the plasma from your blood and treats it by filtering out the offending antibodies causing the inflammation, and then returns the plasma and the blood back to your body. The downside of this is it's typically only effective for a few weeks, and you may need continued intermittent treatments over the course of months or years. And then before I get to the third treatment, I want to also present an approach that isn't mainstream, but it entertains an alternative line of action that, in my opinion, is interesting. I'm going to point you to another YouTube channel by Dr. Lonnie Herman. He talks about ways he supposedly identifies these invading dormant organisms through methods that he doesn't clearly explain. And I'll say he also does funnel you to his practice website where he talks about something called quantum energy work and non-invasive testing methods that enable him to listen to different areas of the body, even specific cells.
Interesting.
I've never been one to shy away from thinking outside of the box, and I have way too many patients that are suffering with no answers and no options left. Mainstream medicine is either not working or not working as well as it used to for them. So I'm always one to entertain alternative practices. And I've watched several of his videos and thought, he does provide an explanation for what's triggering the immune system. Is it real? Is it the modern version of snake oil? I personally can't say, but at least if you want to check it out, you can. All right, so the third go-to treatment is intravenous immunoglobulin therapy, or IVIG, which is what I work with every day. And this treatment involves the intravenous administration of healthy donated immunoglobulins, which is just another way of saying antibodies. Immunoglobulins are proteins that your immune system naturally makes to attack invading organisms. Throughout this, we've talked about the immune system going haywire and attacking the nerves. Every 21 days, the body is making new antibodies, but these are the same ones that have been programmed by the underlying autoimmune issue causing all of this destruction. So, when we give IVIG, it tells your body you can cut back on the Franken antibody production because there's plenty of us healthy ones here, and the body is very efficient and does not like to double up on work. So this essentially suppresses the trigger causing the continued attack on your nerves. And then the outcome of all of this is its anti-inflammatory properties. It is a tremendous anti-inflammatory. So let's zoom back out for a second. Look at the bigger picture. Corticosteroids are particularly beneficial for patients with a more subtle onset because rapid relief may be less critical. They might not be in the tremendous amounts of pain that someone with more advanced disease is, and they're more likely to achieve remission. Steroids are also helpful for patients who continue to relapse despite ongoing IVIG or other maintenance therapy. Treatment in general is continued until symptom resolution or stabilization, and nearly 40% of people will achieve remission or cure with these methods. It goes without saying, neuropathy and CIDP require understanding to manage them. And the more knowledgeable you are, the better you're able to partner with your doctor or NP to find relief. But that does not mean that there aren't natural home-based remedies that you can't employ in addition to medical management that work incredibly well. Castor oil application has had a profound effect on my own neuropathy. So is black seed oil, alpha lipoic acid, red light therapy, all of it. There's also a ton that goes into IVIG therapy. So I've just scratched the surface. And it is also very effective at treating CIDP, but what are the ins and outs of it? What can you expect? And how do you get it prescribed? So I click here to see this therapy in greater detail. Or if you think you or a loved one might benefit from it, then there are entire playlists about IVIG. I go into much greater detail, side effects you can expect, you name it. There are also other playlists that cover all natural remedies that I have used personally over the years. So lots of information. Just do yourself a favor if you have neuropathy and check them out. And in the interim, stay healthy and lucid. Again, CIDP can be challenging because it prevent. Again, CIDP can be challenging because it present. Wait, what? Again, CIDP can be challenging because it present. Just follow the script, Danielle. Just follow the script. Again, CIDP can be causing the inflammation. I'm sweating. I'm sweating. I have to burp. It's like stuck right here. I'm going to point you to another YouTube channel by Doc D. Doc D. Back. And before I get